foundation of CVPH Medical Center was founded in 1989 to provide the hospital with another important facet of healthcare, community outreach. But since then, the foundation has become much more than that. It's now an integral part of the community. The foundation has forged the connection between the generosity of the public and the vital programs at CVPH in need of support. The fundraisers and events that the foundation holds, from its annual themed party, our bicycle rides and fun runs, to our egg hunt on the hospital grounds, and our Circle of Healing and Hope, are able to support health and wellness for the medical center and our North Country community. Now, when those in the community look to the hospital, they don't just see a place where loved ones go when they're sick. They see a place of healing, a place of hope. They see a building and a staff that cares about each and every person, whether they're a patient or not. Through your generosity, the foundation is helping people, funding programs, enhancing care, and touching lives.
My name is Kim Faust. I am the coordinator of the Patients with Special Needs Conference. The Special Needs Conference is a conference designed to help first responders, EMTs, in their skills picking up people who have special challenges and special needs that we don't cover very much or in depth during EMT classes. It gives first responders, EMTs, an ability to give the patients the care that they deserve. These special needs, it's touched on in the EMS class, but it's not, we don't have in-depth training. So we have local experts who provide training to the EMTs, and allows the patients to get better care if they have the right care. This past conference, we had our record, we had over 70 attendees. The foundation helped last year by providing a grant, $1,500. Every year before that, we've financed this conference out of pocket, and we charge a small fee. But this year, the foundation helped out by providing us some leeway money, so we didn't have to fret over how we were going to pay the bills.
My name is Maria Hayes. I am the director for the Women and Children's Service Line here at CVPH Medical Center. We have been trying for several years to open a outpatient breastfeeding clinic for our moms who want to breastfeed and go home and have concerns and troubles, and they need that professional help to continue on, as we have diligently sought support to help us get this program off the grounds. And thank God for the foundation, we were able to get a grant, and we opened officially in May of this year of 2012. We have 2 lactation consultants that see all our patients. It has been very, very successful. We are one of only up in the northeast area here that actually have an outpatient breastfeeding clinic. So we're spreading the word to all our surrounding counties to please, if anybody needs help and guidance for breastfeeding, to please contact us and we will see them. We've had quite a few patients that have left and gone home and have struggled with breastfeeding. We've recently had several of the moms that have come in the day after they were discharged and said, "Oh, at least I know now I can get the help that I need." I can't thank the foundation enough for helping us launch this wonderful for our community.
My name is Carrie Phillips, and I'm the Clinical Learning and Development Manager at CVPH Medical Center. The Gourmet Lunch is an opportunity for staff to be able to come and receive education during their lunch hour. In 2011, we provided 16 different topics, and over 700 people attended a gourmet lunch offering. Traditionally, the gourmet lunch had been provided only on the day shift, but in March of 2011, we started providing gourmet lunch on the evening shift, and in June in 2011, we started providing gourmet lunch on the night shift. Gourmet lunch includes topics such as celiac disease, suicide prevention, zero SOAR. It's not just the flu. So we try to provide education on topics that are clinically based and also based for any employee that comes to listen to our series. I'm extremely grateful for the support rich educational series for staff who come during their lunch hour. So thank you very much.
I'm Beth Ashworth from Respiratory Therapy, and I'm the chairperson for Pulmonary Rehabilitation Services. Pulmonary rehabilitation was currently revamped from the old pulmonary exercise program that had been in existence since about 2009 in CPH. We've remodeled it so that Medicare and private insurance is reimbursed for it, and in doing so, we've been able to offer the program to more patients. We considered for lung transplant to be currently enrolled in a pulmonary rehabilitation program that follows Medicare guidelines. We needed funds to purchase equipment such as weights for the patients to use pulse oximeters so we can measure our patients' oxygen level and heart rate while they are exercising, a model of a lung. And we talked to the foundation, and they very gracefully granted those funds to us to provide these educational materials to the patients in the program. The types of patients pulmonary rehabilitation sees are patients with chronic obstructive pulmonary disease such as emphysema, chronic bronchitis, asthma that we're not able to treat as an outpatient basis. We also treat patients that have pulmonary fibrosis, it's scarring of the air sacs, and patients that have pulmonary hypertension, where the artery that goes to your lungs, the pressure in that is too high. Currently, the main specialist in the area is Dr. Hopkins at Fletcher Allen, and the waiting list for their pulmonary rehabilitation program is 18 months to 2 years.
But today, we went over their different diagnostic testing they do for their respiratory disease, and then most important one, pulmonary function testing. A lot of them have been told what their numbers are, the percentage. They actually got a picture today, and what it is a loop, how big a breath they take in, and then we have them blast it out as hard as they can, and then keep squeezing, and blow it out. And then seeing this, and then looking at the dots, that's where they're predicted, that's what they should be at. So they can see, when they understand why they need to do what the doctors ask them to do, it's easier to do it, to comply. It's like, oh, okay, that's why I'm supposed to be. Well, one told me, she said, I'm going to show my 25-year-old who still smokes and tell her she needs to go get this test done.